There's some questions revolving around, um, let's see, what is the worst adverse effect? Are ablative procedures safe on dark skin? And I think somebody else mentioned a question about they see the marks around eyes when the procedure is done, and I think they're wondering those look like burns. That how does that heal and when does that go away?
I mean, Arash, I'll answer
I
this,
can
and
answer that. You want to answer that? Okay, go ahead.
I want to answer it, but I want you to answer it also. But I'm going to tell you, I mean, obviously we're all in different places, so we haven't coordinated these answers. And so I think it's good for you guys to kind of see, how we approach this. Obviously I've used energy-based devices now for, over 10 years, probably closer to 15 years in my practice. And CO2 laser was the first device that I ever purchased. And so I did deal with a lot of post-inflammatory hyperpigmentation. I dealt with scarring. We had some hypopigmentation that we dealt with. So energy-based devices in general really scared me because I started out with something pretty powerful that I didn't fully understand the technology, and it was a bit of a learning curve. So I do recognize that as we bring new things into the practice, that there are risks associated with anything. And so I'm usually a little bit hesitant. We have used this on all skin types. We continue to use it on all skin types. I am more cautious for sure with any of my higher Fitzpatrick because I still worry about that. We just have a patient that we're treating for keloids, and she's a Fitzpatrick 6. And I had this conversation with Arash. My concern there is actually depigmenting or hypopigmenting that area when we remove it. The keloids are, I feel confident we can get rid of those with the Plexr. And Arash has an interesting case I'm sure he'll tell you about in just a sec with that. My discussion was we have other options. If we get rid of the keloid, then we can also look at doing something like tattooing the area to match the skin. Right now, she can't cover it because it's a big keloid. But if we can get rid of that, even if there is some hypopigmentation, obviously with tattooing, it's not great in keloiding patients. So we have some other risks there. But Arash, why don't you tell them about the case that you told me about recently in that?
Absolutely. So for Plexr, again, because we don't have thermal damage, so our melanocytes are healthy. We don't burn our melanocytes. So in terms of skin color, like 5-6, we had one case recently, which was in New York, a plastic surgeon, basically in New Jersey, Dr. Fisher. He removed a keloid from skin type 6, and then he experienced depigmentation after the procedure. And 2 weeks after procedure, it was 100% repigmentation in all area. So basically, he took care of the whole keloid, and there was no hypopigmentation, nothing. It looks like that nothing happened at all. So basically, with Plexr, as far as I know and I experienced for the last 12 years, the risk of hyperpigmentation based on our multiple clinical studies is less than 2%. And hypopigmentation is really very, very rare.
So some of the things that we do, and actually one of the reasons I was kind of afraid of this technology and afraid of bringing this into the practice was because I too have seen and have treated patients who've had the little marks all over their face, the little squares from having treatments. And, what I realized several years ago when there was kind of a boom in the market of these, it was a general term of plasma pens, and there was no regulation on this. So people are getting these devices from Amazon, from all these different places that are not approved medical devices, and they're being performed by people who are not always properly trained on the use of those devices. And what I think that you guys, if you take anything from this webinar, is understand that this is not an electrocautery unit. I think there's a lot of comparison to that. And I think when you see it and you watch people perform the procedure, if you've been in medicine, it looks like a cautery, like an electrocautery. And so you assume that you're burning the tissue. But you have to go back and think about that mechanism slide that we saw just a few minutes ago, where we're ablating the tissue. We're removing that, turning it to smoke. We're not burning it and leaving the tissue on there. Right. And so it is a difference. And this is plasma energy. It's not electrical energy. So it's a difference in the energy, the way it impacts the skin. And so a lot of those marks that you see when I ask the patients and talk to them more about it, they're from these electrocautery units. They're from these cheap devices that are not generating real plasma. They're basically creating a burn on the skin. And so they're burning patients. And through the scarring process, they're creating a little bit of a tightening. So if you burn someone enough, like any of us burn your hand, you'll feel that tissue over the burn feels tighter for a little bit of time after that's healing. So they were going and getting, these patients are getting controlled burns. And then they're ending up in places that they're having to be treated for the post-inflammatory hyperpigmentation. And that's because those devices really aren't designed to do necessarily what people are doing with them. So don't get it confused. This is a different device altogether, right? It looks similar when you watch the treatments, the patterns are similar, but this is a plasma device. It is not an electrical cautery device. So you should have a very low risk of having any of that. Yes, you will see those marks on there for the first couple of weeks because they're going to be dark, they're little marks and they fall off, but that does not say they're long-term. I haven't seen any of that in our practice. I want to knock on wood as I say it. But I have not seen any of this. And that was one of my biggest fears. I think I talked to you about it before I got the device because I was like really afraid because we had seen quite a few cases from people in our area that was not an approved device that was getting this done and we were having to deal with the complications. But, like I said, I think that speaks to the quality of the device and the type of energy and understanding why we're choosing this over some electrical device that could create a burn.